So good afternoon again, everyone. My name is Binta Sako. I'm a technical officer at the WHO Regional Office for Africa, and I'll be your moderator today. It's with great pleasure that I welcome you all to this very important session, Beyond Emergency Care, Strengthening Post-Crash Response, Protection and Rehabilitation for Road Victims. So surviving a road crash is just the beginning of a long and very often challenging journey for victims and their families. While immediate medical response is critical, the true post-crash care extends far beyond the emergency room, encompassing rehabilitation, legal protection, financial support, and social reintegration. And this is the right place to discuss all of this. So today we will hear from experts across the health sector, transport, legal, and victim advocacy, as well as gain insights from Africa, Latin America, Asia, as we explore how countries can strengthen their post-crash systems to ensure that survivors receive the care, protection, and the dignity that they all deserve. So I look forward to engaging, with you in these discussions. And let's begin. So we'll start first with introducing our esteemed Dr. Abdul Bakani, who will be making opening remarks and will set the scene to this session. He is a leading expert in injury prevention and disability research. He's the director of the Johns Hopkins International Injury Research Unit, where he leads a multidisciplinary team of faculty and scientists dedicated to identifying solutions, influencing policy, and advancing the field of injury prevention globally. Dr. Bakani's work focuses on understanding and addressing the burden of injuries and disabilities with a strong emphasis on health systems and rehabilitation services. His research explores innovative ways to measure disability, assess the long-term impacts of injuries, and enhance data collection for injury prevention, particularly in low-resource settings. So, Dr. Bakani, welcome. Thank you.
Thank you, Binta, and really great to be here as part of this session, which, as Binta said, is an extremely important part in the spectrum of road safety. When we talk about post-crash care, usually people's minds immediately go to ambulances. We think about the immediate pre-hospital care that people receive. But in this panel, hopefully, we will talk about, as Binta said, beyond that immediate emergency medical services and into acute care provided at the hospital, as well as rehabilitation services and social services for reintegrating people back into the society, getting back people to the level of functioning as much as possible to pre-injury levels. So why is it that we're talking about addressing post-crash care? We know that injury prevention continues to be a central focus in reducing the burden of injury from road traffic crashes. But it is important to really also focus on the downstream factors. While we prioritize prevention, we will not be able to prevent all crashes from happening. Crashes will happen, and we really need to be able to deal with the consequences of those crashes, and therefore need systems in place that will help us deal with these issues. Improvements in care that are provided to injured patients will improve outcomes for injured individuals by decreasing mortality and morbidity, and help restore functioning and independence at home and at work, and therefore a more vibrant and productive society. And this is where we then start talking about trauma systems. When we think about trauma systems, really what we're thinking about is an effective post-crash system that goes from providing timely and efficient care at the scene of the injury, transporting the patient to the hospital, correct diagnosis of that injury and what care is needed, provision of care at the hospital, as well as rehabilitation service provision. And this is what encompasses a trauma system. It is the component of the health system that provides emergency and post-emergency care, as well as rehabilitation to injured individuals. So it really does extend from prevention all the way to reintegration into society for patients, and ensures a reduction in long and short-term consequences of road traffic injuries. Now, usually, and I had a slide which unfortunately we're not able to present, in higher income countries, we have the spectrum present where we have efforts on prevention. When a crash happens, there's emergency medical care available, there's care available in the hospital setting, as well as then rehabilitation services available and follow-up services to deal with the consequences of those disabilities. But in many low and middle income countries, key components of this spectrum are usually missing, right? Usually, we don't have enough of a focus on prevention, and we keep talking about that, and that is being talked about in many different sessions as part of this conference and other convenings that we have. But then we also lack emergency pre-hospital care. Many of our countries, low and middle income countries, do not have an effective and efficient system of pre-hospital care. There's no one number that people can dial. There's no coordinated communication. There's no triage. Ambulances are not staffed appropriately. They're not equipped appropriately. But then we also lack rehabilitation. Yes, we can save people. People come to the hospital. They may receive care at the hospital if that system is working, but after that, then what, right? And that's where rehabilitation services also are an important component of this system. And so based on that, what I wanted to highlight are three key objectives for post-crash care. So one is to avoid preventable death and disability. Two is to limit the severity and suffering caused by road traffic injuries, both physical and mental, because it's important to focus on the mental aspects as well. And to ensure optimal functioning of crash survivors, that is reintegration to society, to make sure that people are able to resume their normal day-to-day activities and be productive members of the society, both socially as well as economically, and this will have huge benefits to societies around the world. So when we think about trauma systems, we can really then, based on this, divide them into three distinct components. There's the pre-hospital care part, there's the hospital care part, and then there's the post-hospital care part. And key considerations that we need to make for each of these components: for pre-hospital care, we need to ensure effective communication, that there's a number that people can call. There's a dispatch center that communicates with the appropriate ambulance services to go to the scene of the crash. There's communication between the ambulances and the hospital that will be receiving the patient so that the hospital can be ready for patients. We found in many low-income countries, we're quick sometimes to get to the scene of the injury, but then the hospital is not ready, and there's many different stories. For example, one from Kenya, where a patient waited in an ambulance for a hospital bed for 14 hours and ended up dying in the ambulance. So really, communication is key and important. Transportation is important, as well as triaging. When it comes to hospital care, we need to make sure we have appropriate human resources, adequately trained human resources at all different levels. We have the appropriate infrastructure that we need to be able to provide care, as well as the ability to provide definitive care at the hospital. And when it comes to post-hospital care, of course, we need to make sure that rehabilitation services are available right from the acute care setting. Rehabilitation needs to be integrated into the trauma team's functions, right? As is in many high-income countries, and there needs to be then follow-up care for physical therapy or occupational therapy as needed. So rehabilitation, we don't talk about very often in these settings. And what I want to do is take a few seconds at least to highlight the need for rehabilitation. Rehabilitation really helps to alleviate suffering. It prevents further risk from harm, and optimizes functioning for individuals. That is, it tries to restore independence and reintegration into society. These services, as I said, are not readily available in many low and middle-income countries. Most patients are discharged without any access to rehabilitation services, and these services, where available, are often very limited and very expensive for people to obtain. And investing in improving access to rehabilitation services will really be based on a multi-pronged effort. So we could have home-based rehabilitation, community-based rehabilitation centers. We will be able to reduce morbidity, and it will speed up recovery and reintegration of individuals to the society. Faster return to work and reduce independence on family members. We found that people post-injury often rely on family members, and many times if an elderly person is injured and needs care, it is the children who stay home from school, and therefore impacting long-term what they will be able to achieve. Right. So strengthening trauma systems really does require a systems approach that focuses on key aspects of governance and legislation, service delivery, as well as data and capacity development. And hopefully we will highlight some of these issues in the panel discussion. And we found that strengthening trauma systems has huge benefits. Numerous studies have documented these benefits, and studies have shown that improvement in trauma systems could save more than 1 million lives, cutting road injury deaths by up to 30%. Studies have also shown that a 50% reduction in preventable death rates after implementing trauma system strengthening approaches. So huge benefits to be gained. A lot of times we think these are expensive interventions to implement, but they're really not. And they have huge benefits, so if you are looking at the cost-benefit ratio for these interventions, it's really not up for discussion at all. It's a done deal. I think if you're looking for a bang for your buck, this is where we need to invest. And with that, I will stop here. Thank you all, and looking forward to the panel discussion.
Thank you very much, Abdul. I cannot imagine a better way to set the scene for the discussions with this thorough overview of the path to getting back to a normal life for victims of crashes. And thank you also for highlighting the importance of rehabilitation in this process, and also the cost effectiveness of the interventions, because we often think that we are too poor to afford these services. So thank you very much, and I hope that during the discussions with the panelists that these issues will be brought to life and into the discussions. So we'll be entering the second phase of our panel, of our session today, which is the panel discussion, and I'm very pleased to invite the different panelists who will be part of it. Let's begin with Dr. Leticia Cardoso. Leticia Cardoso is a trained nutritionist. She holds a master's and PhD in public health. She is a career researcher at the Osvaldo Cruz Foundation in Brazil. So she hails from Brazil, and currently she heads the Department of Epidemiology, Analysis and Surveillance of Non-Communicable Diseases and Conditions at the Secretariat of Health Surveillance and Environment of the Brazilian Ministry of Health. So let's please have a round of applause. Thank you. Our next panelist is Mr. Grace Mark Tusubira, Policy and Advocacy Manager at the Uganda Red Cross Society. He plays a pivotal role in shaping humanitarian policies and leading advocacy initiatives. And in addition to his managerial duties, he is also the organization's international humanitarian law focal point, emphasizing his commitment to legal frameworks in humanitarian contexts. Thank you for being here. Next is Viviane Perón. I hope I'm Perone. Thank you very much. She is the founder of Madres de Dolores, coming from Argentina, member of the Global Alliance of NGOs for Road Safety, and co-chair of International Road Victims Partnership. Viviane is dedicated to advocate for victims' rights and rights, and has extensive experience in policy development, public awareness, and victim support. So very happy to have you here. Our next panelist is Mompati Bonsibokwa. Thank you very much for being here. Mr. Mompati comes from Botswana. He's the Senior Manager, Injury Prevention at the Motor Vehicle Accident Fund. And he holds this position since 2008, so has about 15 years of experience in this area of traffic safety management, and also policing experience during his tenure at the Botswana Police Services. Thank you very much for being here. Let's give it a... And last but not least, we have Mrs. Najiba Suleiman, who is the Senior Special Duties Officer at the Ministry of Transport and Communications from Brunei, Dar es Salaam. She is the head of the Transport Safety Division, overseeing safety regulations for aviation, maritime, and also road sectors, and she also serves as the Secretary to the National Road Safety Council. So thank you very much for being here. I don't know if we have Ismaili Mohammed as well. So, okay. So these are our panelists. Thank you very, very much for being here. We really have representations from all over the world, so we're very, very grateful to that. So the session, we have a few questions that will investigate and, we'll try to gain your insights around the different topics we talked about, beyond the crash, what happens. We have leading questions, but feel free, to come in, and the questions will be addressed to one or two, but we hope that all will be able to give their insights when they can. Thank you very much. So I'll begin with the first question. Abdul, you talked about this continuum, and we'll be kind of going through that path. And we'll begin first with the emergency response and the pre-hospital care. So to Leticia, what are the most critical challenges in emergency trauma care and first response in your country, in Brazil? And how can the challenges that you've identified be strengthened? I think, sorry, there are no, yeah.
Thank you. First of all, I would like to say thank you for the invitation to be here today, representing my ministry, Nízia Trindade, who is the Minister of Health in Brazil, the first woman to be a Minister of Health. I would like to highlight it. And, we have many big challenges in our health system. As you know, we are a federative country with more than 5,000 of municipalities in the country, in 27, split in 27 states, which is a huge decentralized health system, public health system. And it brings to us the challenge of connect every piece of the country with the state level first and then the national level. So we have two important marks in the health sector to organize the policies of emergency care. One of them is pretty new. It's the National Policy of Specialized Health, which coordinates the emergency care in our country. And nowadays, we are strengthening the units, spreading around the country, and also increasing the medical teams. So we now have almost 90% of the population covered by this system. It's important to mention that it is a public system. So because of this, we have to connect in each level of assistance and to keep in mind that the journey As Professor Abdul told us, it's important to prevent, but also it's important to care. In this whole system, the main challenge is the rehabilitation. Now we are strengthening the medical care, the units, we are spreading the country, but the rehabilitation, we have some centers, reference centers, but we know that we don't have the cover that we need to have. They are very high quality centers, but it's not covers everybody. And last year we had 34,000 of victims of deaths in the country because of road traffic. So I would like to highlight this strengthening of spreading and training with digital tools of these medical teams, but the main challenge is to have our unified information about the whole journey of the victim, and the other challenge is to have is to increase the cover of our rehabilitation system, include the therapy, the physiotherapy, mental health issues, and the occupational therapy.
Thank you so much, and it's quite impressive to have 90% coverage in a public system. It's great to hear that. And also thank you for sharing the gaps that you're identifying. I think many countries will recognize themselves in this as well. Abdul, would you like to add anything to that?
Yeah, no, I was just taking notes based on what Letitia said. But I mean, Letitia mentioned the role of technology. I think that's really important, and it comes in at multiple different levels. And we have advancements in technologies that can help us, both with respect to providing emergency care, understanding where and how, anticipating what it is, where resources will be needed, but also downstream when it comes to rehabilitation. One of our challenges is we don't have enough trained rehabilitation personnel, and we don't have the facilities at lower levels of care. But that's where technology can come in, and there have been examples where technology has been used to allow lesser trained or people who are not trained as rehabilitation providers to provide basic rehabilitation services, or even make the assessments and coordinate care upstream and manage cases downstream as well. So I think that's one very important thing that we really could be leveraging this technology.
Yeah, great. And talking about, low resource settings, I don't know if, Mark, you would like to, share some experience from the Uganda Red Cross around the services to victims, including either emergency or also rehabilitation services.
Thank you very much, and good afternoon. Sharing the perspective, the Ugandan perspective, especially from the way Uganda Red Cross operates, we have a fleet of 21 ambulances on the major highways in Uganda that respond to road traffic crashes and accidents. Now, just as a brief preamble, in 2022, Uganda Red Cross did a survey together with the Ministry of Health, ascertained the hotspot areas that had road traffic accidents, those hotspot areas, and received funding from government of Uganda to deploy 21 ambulances in those strategic areas. The country is too big, so the 21 ambulances are quite few, but at least they provide some semblance of hope for fast response. Now, we have been operating with the few ambulances we have. And when we began, we were receiving a budget of about 19.4 billion Uganda shillings, which is an equivalent of 2.5 million US dollars. But now the budget has gone down to about 5.02 billion Uganda shillings, which is about 1.3 billion US dollars. But the number of road crashes has not gone down. So we are suffering in terms of response in terms of ambulance services. Our ambulances are also aging. In 2022, we had new ambulances, but 2025, the ambulances are quite aging, and that slows down the response. You could have instances where the ambulance actually breaks down before reaching the victim, or breaks down after evacuating the victim from the road cross, from the traffic accident. So those are, that remains a very big challenge. But way beyond the response, as a country, we are lacking rehabilitation centers. So it is one thing to have you evacuated from the accident scene, and we know that the evacuation has to be done quickly because the first 60 minutes it's a golden hour. You can either lose your life or have your life saved. You can save your limb or have it taken off if you're not responded to well. But way beyond the response, there's another big challenge of if you're taken to hospital, the hospitals have the equipment to take care of you. In the event that they do they have rehabilitation services to take care of you? And those are some seriously big gaps that we have. And also, the coordination is really quite poor. And I know, Abdul, you spoke about the fact that we need to have a uniform emergency line to call. In my country, we don't. For example, as a Ghana Red Cross, we have a toll-free number that is different from what the government or police use, but we are doing the same thing, and the end result is the same, saving lives from road crash victims. But we call a different number, and it's not like 911 or 99, it's a long number. So memorizing it also becomes a challenge. And I think moving forward as a country, we need to harness the potential of having unified numbers to call. If it is 911, it's 911. If it is 999, let it be 999 for, say, for a region. And that makes response way easy. But I think moving forward as a country, there's a lot we need to do in terms of just preparing the victims of road accidents way after the crash. So yes, thank you.
Thank you so much for sharing the experience of Uganda with very practical, examples. And I think the issue of rehabilitation has been raised in Brazil, in Uganda now. So we know that this is a major gap, and not only the services, that are present, but also I hope at some point we'll be talking about their cost, because they're not for free. So this is also an additional challenge to rehabilitation services. So in that theme of rehabilitation and long-term support, I would like to bring in Vivian to share her experience as well.
Okay, thank you very much. Thank you for having invited me. As regards rehabilitation and long-term support, as you were saying before, we know that it has to be coordinated, but it should be a victim-centered approach, right? And we know that we have to connect everything connected to pre-hospital care, medical treatment, and then afterwards, getting back into society, making the victim be able to return to society. But there are barriers. There are social barriers, legal barriers, administrative barriers, and because of that, generally maybe the victim is in hospital and the family is running around from one place to the other, trying to see how it is that they can go on with this expensive medical treatment. So, well, in Argentina, what we have is we have a number, which is 149. It's a different number. That number, it's a hotline that is open 7 days a week, 24 hours of a day. And there you have a psychologist, a lawyer, yes, that can assist you also, just to give the first assistance at the first moment. And then, for example, together with the victims, we wrote reports so as to assist victims in whatever they need. And in Madres del Dolor, in my NGO, there is a lawyer, who I am going to name Dr. Natalio Nicodemo, because he works for free for us. And he wrote a project so as to have a national fund. Because, for example, if a victim is run over and it is a hit-and-run case, the victim doesn't have any support, any financial support for the medical treatment. or if the driver doesn't have an insurance. So we are speaking about a national fund so as to help victims with all of the medical treatment that they need. Thank you.
Thank you very much. And if you were to give advice to countries on how to strengthen these services, rehabilitation and long-term care, what do you think would, trigger action, or even in your experience, maybe in Argentina, and others may have experience of having pushed the government to act or private sector to, to get involved? What would be the message or the advice that you would, share with us here? Yes.
Okay. Well, the first thing that I would tell at least my government is that they would be saving money, because they're constantly thinking about the money that they're spending. They're not thinking about saving lives, yes? They're not thinking about all of these lives that are lost. And it's not just one victim. It's not just Kevin. It's the father, the mother, the grandparents, the friends. Everybody is involved in it. So if they help for the rehabilitation, when Kevin was killed, his friends at school had a very difficult time. And the teachers and the professors, they didn't know how to deal with it. There should have been a psychologist there to help them. Yes? Do they speak about death? They don't have to speak about death. How long do they have to speak about how? So I was teaching in the same school where Kevin was studying. And 1 week later, I had to go back to work in the class next to where his desk was empty. So that is also very difficult. And the bills kept coming home, so I had to keep on working. So I think that first we have to tell the governments, look, you're going to save money. Help with rehabilitation, help with everything that is connected to road safety.
Thanks for reminding us this is really a human issue. It's people behind it. It's not numbers, it's not strategies, it's actually people's lives. And so it's, yeah, very touching, very touching. Thank you very much. We will now talk about victims' rights and protection, legal protection. And how can countries strengthen this? Because we definitely see that there is a weakness in terms of protection and compensation of victims and their families, whether it's an injury or death, and the costs that come with that. Can I bring in Mr. Mompati to share a bit of your insights with your experience in Botswana, please?
Thank you, and good afternoon. First of all, let me introduce you to what Botswana has done in terms of the Motor Vehicle Accident Fund, what it is in relation to victim protection. It's a parastatal or a state-owned enterprise that was established as far back as 1986 and started operation in 1987. And its specific function is to provide compensation support in the form of benefits to victims of road crashes. This means that we recognize that road traffic crashes victims have rights. They have the right to access medical care, rehabilitation services, and also the survivors, like the minors and the spouses who may be lost. The one that was a provider also needs somebody to step in to provide that financial support as well as psychosocial support, even to the minors. So the Motor Vehicle Accident Fund has been established for that. It uses a fuel levy system whereby, because it stands in on behalf of the driver. So when a driver puts fuel in the car, there is a small amount of money that goes into the fund. That is why we are called a fund. And what it does, when somebody gets injured in a road crash, immediately MV Fund steps in. It starts right from the time when a crash happens. We have come into contract, into relationships with the private EMS companies, because the government is limited in terms of EMS services. So we have contracted with the EMS, private EMS. Whenever an accident happens, they receive a call, they have to respond within the golden hour. And we cover those costs. And when they go to the hospital and they take the victim to the nearest appropriate hospital, whether it's government or private. So if it's private, we are liable to pay all the bills for that individual when he gets there. It doesn't only end with the hospital care. It also has to go into rehabilitation, because these people, sometimes they have to go through long-term rehabilitation process. So we also cover the rehabilitation services, including finding where they can get the expertise to be rehabilitated. Some of our victims, we even take them to as far as India from Botswana, where we can get the relevant expertise to be. And the other thing that is very critical is the support that goes into the person that is incapacitated, maybe having suffered a spinal cord injury and needs to go back to work. We advocate for return to work services, such that companies and the public sector must be able to reintegrate these people into the workplace. And also we support them into becoming rehabilitated into their families, providing the social support, and also providing for the care of these people. But now coming to the minors who have lost a parent who is financially supporting, we also provide what we call the loss of support benefit. We cover them until they would have reached the age of maturity. And for the spouse, we cover them until the person who is deceased would have reached the age of retirement. So this comes as a huge cost, but we have been managing that for years. Because we believe it's a right for the individuals to be covered, to be protected. Now, when it comes to other protection rights, it goes into aspect like proper investigation of crashes. Not only to find fault on the driver, but a very comprehensive investigation that should establish how other elements of the system have contributed to the accident. Because it is that information, that data, that will then inform decision-making going forward. So basically, in a nutshell, this is what we are doing as as Motor Vehicle Accident Fund. And we are also supporting the police in terms of training, because we realize that they may not have the resources. We support the health department in terms of maybe provision of ambulances and so on. These are some of the things that we cover to improve protection of road victims.
Very much. I think it deserves a round of applause, because it's really a great system that touches on all the different aspects that make sure that people go back to their daily lives. This is excellent, and we know that Botswana is one of the few countries in Africa that actually has this system together with Namibia. So really bravo. And I don't know if any other participants here can add on to that. Thank you.
Yes, I'd like to add something as regards victims' rights. First of all, could I ask the victims' families that are here to stand up? Those of you that have lost somebody in a road crash. Okay, so there are many. Okay, thank you very much. So this is just to show that we victims are together. I am here, but we all have one voice. Yes, we all are together in everything that we're fighting for. We have to fight for everything. We have to fight for a booth in the exhibition. We have to fight for a place so as to be able to talk. We have to fight for justice. We have to fight for medical treatment. And that sometimes gets us really tired. So we thank you for what it is that you're doing, but we know that we need much more. Yes, we need much more. We victims got together and we wrote a manifesto, yes, that you can find in the exhibition or that we're going to give out now, showing what it is that we need, because why is it that we're here? We don't want anybody else to be suffering like we do. We don't want anybody else to be in our place. So this is why our voice is one and why we're fighting to be together and to avoid any more victims. Thank you.
Thank you very much. Thank you. Najiba, would you like to say a word?
Thank you for highlighting the important issues. First of all, very good morning to all distinguished guests, esteemed panelists, and respected member of the audience. I'm honored and humbled to be here today to share Brunei's approach to strengthening legal protection and compensation mechanism for crash victims and their families. It is essential to begin by recognizing that Brunei places a strong emphasis on public safety, and this includes a robust legal framework for road traffic and compensation for victims. Strengthening legal protection and compensation mechanism for crash victim and the family is a critical issue in Brunei. Brunei legal framework is designed to ensure accountability and provide support to victims of road accident. Under the Road Traffic Act, Chapter 68, we have stringent law in place to address dangerous driving, reckless behavior, driving under the influence of drugs or alcohol, and etc. For example, driving a vehicle without a valid third-party insurance is a serious offense. If an individual is caught driving without a valid insurance, they face serious penalty up to 10,000 fine and imprisonment for up to 12 months, and the loss of the driver's license for at least 1 year. This measure not only deter irresponsible driving, but also ensure that victims have access to compensation through mandatory insurance coverage. Additionally, our healthcare system plays a vital role in post-crash rehabilitation. The healthcare system is basically free for all citizens of Brunei, with a minimal charge for administrative purpose. Victim and their family receive a comprehensive medical care, including therapy and mental health support. This provides a crucial safety net for those involved in accident, ensuring that they receive the necessary medical treatment, whether it's for minor injuries or more severe condition. The government also covers a wide range of treatments, including therapy, mental health consultation, which are important for post-crash rehabilitation. For those who suffer permanent injuries, Brunei has introduced the Old Age and Disability Pension Act in 2021. This program provides financial assistance to individuals with mental disorder or permanent injuries such as loss of limbs or wheelchair-bound condition, ensuring they receive the support they need. Brunei has experienced a notable reduction in road accident fatality over the past decade, with a 50% decrease in the past 12 years. Our efforts yield positive results. This reduction is thanks to a combination of strict enforcement and penalties, including regular enforcement, public awareness campaign, and robust healthcare support. Furthermore, the Brunei Darussalam National Road Safety Council, which I will share more later, plays a vital role in the whole of national approach strategy in road safety holistically. In conclusion, the legal and social framework in Brunei ensure that victims of traffic accidents are provided with essential protection, from compulsory insurance to healthcare and rehabilitation service. Thank you for your attention, and I hope.
Thank you very much, Najibat. Thank you to all who have shared their experiences so far. It's really very rich, and you said the word holistic, because everything builds into each other and everything is important, and we have to make sure that we keep the integrity of the continuum of care. So thank you very much for these insights. And Abdul talked about cost-effective solutions, and yet our governments are always talking about the high costs of post-crash, of rehabilitation services, some thinking that, we're too poor to afford these services. So I would like to have a bit of your insights into the financing. It was alluded to by Botswana, but what do you think would be the role of the private sector, let's say, into this whole space of care and services. I'd like to direct maybe the question first to Mompati, because you had begun talking about the experience of Botswana and how you raised funding. So over to you first.
Thank you. The role of private sector in all this. Road safety is a shared responsibility, and it affects us all, whether we are in the private sector or in the public sector. So I think we first need to see ourselves as part of the solution. So the private sector ought to find a way of contributing to road safety, particularly when it comes to issues of victim care. One of the things that we are looking into now, it's how to advocating for integrating issues of road safety into our day-to-day occupational health and safety operations as organizations, whether you are public or private sector. We must see safety as an integral part of our day-to-day operations. So one of the things that the private sector can do in supporting road safety and also supporting victims is to ensure that they participate from the prevention side. Secondly, is to have a policy around return to work. Because at the end of the day, when somebody gets injured, either while was working or in his private capacity, that individual, as long as they still have the ability to come back to work, you must have policies that would support that. Even if it means maybe changing the role and giving the person another role, that is another contribution. The second thing that we are seeing as a challenge, even though there is a policy framework or a law, it relates to having compensation structures, such as we call it workers' compensation. This is something that has to be mandatory in organization, so that when somebody gets injured while at work, there is something that they have a fallback. They can be compensated. So I think the private sector can also come very proactive in that sense, to have compensation schemes in the form of workers' compensation. So basically, I think for me, these are some of the things that the private sector must come through. And the last thing, it's relates to return to work. It's creating a conducive environment for people who, with disabilities resulting from road crashes, to be able to access our facilities. The access into our buildings, access into our offices, it's a big issue. So we need to make sure that as much as we see ourselves as part of the solution, let's at least provide access, a ramp for people for access into our facilities and working spaces that are accommodative and that are user-friendly to those that have suffered. Because that is only when these people will feel integrated and part of the whole system. Thank you very much.
Bringing in the issue of disability inclusion, which seems to be, really very far behind in many countries. I cover Africa, so I can say that this is still a concept that people need to grasp. And this is really very, very important. And I don't know if any of you experience in Brazil, for example, around that inclusion of making sure that we accept people with disabilities in the workplace and we accommodate for them. What is your experience in Brazil around that?
Yeah, it's an important issue to include, and there are many initiatives in the country, especially in the public sector, to include them with special spots during the public concourse or the public tests to be a public employee. There are many initiatives in the public education system also to include them. And I would like to come back in the point of the role of the private sector that you posted on, before, I think the problem of road injury and victims and deaths is a problem of the whole society. All the sectors, the private, public, academia, everybody needs to be involved, because when we think in investments, we are not talking about just about the economy. At least if we think in economy, we are losing lives. It's not correct to think it's just a problem of the public sector. I would like also to highlight the miss or the gap of legislation of many informal workers that are also victims. For example, with the Uber, other companies that spread in the world, that many of our countries doesn't have a specific legislation to protect the worker. So after the accident or after the injury, we have to support the families, we have to support the people who stay in their families, that the people live or the people were like a disability, with a disability. So I would like to highlight this point too, because it's a very important point that I think many of the countries have to advance in this discussion, calling them for the responsibility too.
Thank you very much. The responsibility to support their people, basically. Thank you very much for that. And I'd just like to bring in also Mark, Grace, sorry.
Yes.
Yeah.
Thank you. And I would really want to give a very interesting stat that I read. 1.25 million people lose their lives annually. And about 50 million don't lose their lives, but are victims of road crash accidents. That is a huge number. And from today's submission in the opening ceremony, there was mentioned that the major cause of death for young adults between 15 to 25 is road crash accidents. That is a very big problem for everyone, because these are our brothers, these are our sisters, and you could see my sister here is portraying someone who lost their lives. And this is just one person, there are many out there. So the private sector has a huge role to play. One, let me extend this to employment, to those of us that are formally employed. Once you lose your limb, in the unfortunate event that you lose your limb, you may not get your job because you'll be deemed not fit for the purpose, and that has to come to an end. I'm looking at this in the way that previously, breastfeeding mothers were not allowed to come to work with children. But now, you can come with your child to work, and there's a special room for you to breastfeed your child and get back to work. We can adapt. We can adapt to these changes. We can incorporate our friends, our relatives, our colleagues at work who have had crashes to come back and work together with us, because it will not take away their special skill. I like what the lessons I've been getting from Botswana. And I'm thinking, there's a lot we can learn from them. Clearly, there's a lot we can learn from them, from the fund and how they're organized. And I think as a country, Uganda, we can also pick those lessons and incorporate them into our structure. But in addition to that, I also think the private sector needs to do a lot of advocacy around compensation for victims. In my country, the law relating to third-party compensation is 39 years old. 39 years, very old. No amendment has been done for over 39 years. The compensation limit is about 1 million Uganda shillings, which is an equivalent of $270 US. that may not even cover your hospital bills for a day. It is literally peanuts. And that's the cap. You cannot get anything beyond that. Last week, I received a phone call from a friend whose sister was involved in a bus accident, and her leg was amputated. And she was seeking damages. She wanted to sue the bus company, but the cap is $270. She may not get anything beyond that. And her legal expenditure alone cannot be $270. That is a little money. So as a private sector, we need to push for these legislations to change so that things start to move in a direction that is contemporary to the issues that we are facing. Then lastly, before I take leave of this matter, we've spoken of third-party motor insurance. That is mandatory. In my country, government vehicles do not have third-party insurance. They are not mandated in law to have third-party insurance. So when a government vehicle knocks you down, you have to sue them, and you sue the Attorney General of our country. That is a very long legal process. One you may win after a very long time. But as the private sector connection and collaboration, that is something we can advocate for. Let everyone have third-party insurance. Let us increase the limit. Let us incorporate our colleagues that have had accidents. Let us set up rehabilitation centers, because the statistics are not lying to us. The effect of road crashes is huge, and not stop today, it will still go on. So as a country, or as colleagues here from all over the world, I think this is the message we should be sending back home once we return, that, look, there's a big problem, and we need to address it. Thank you.
Much, Grace. This is well said. We have a message to take back to our own countries. Thank you. And before we leave this subject, I wanted to get Abdul in your perspectives on, to convince, we often need data. So what are the elements that you recommend we use in the data to convince? How can we package the data? What can we show governments to really understand that this is an investment? It's not an expense. It's an investment actually for the development of these countries.
Thank you, Binta. I mean, really great point. And when it comes to data, again, we often think that we need really high-powered surveillance systems, and we need the best data sets we can get to be able to make the case for investments in this. When really it is sometimes telling the stories, sometimes speaking to individuals who are making these decisions to highlight that this is a problem. Yes, do we need to highlight the magnitude? Yes. We need to show them that there's a huge benefit to the investment. Yes, we need to do that. And some of these numbers do exist, and we can utilize a simple analysis to show that these investments will have huge benefits in terms of return on investment based on economic productivity, based on social productivity of individuals, as well as the number of lives that will be saved and the morbidity that could be avoided. So yes, we can, in many of our countries, we have data systems that are severely lacking. We don't have timely data, valid, reliable data coming in on a regular basis. But we really need to understand what it is that is driving the policymaker that we're speaking to. Because what drives me may not be the same thing that drives Mompati or that drives you or that drives anyone else. So we really need to understand our audiences and curate our messages and frame our arguments accordingly for each of our audiences. I think that's the more important part, and then utilize the appropriate information to be able to make that case.
Very much. Thank you. It's a lesson in advocacy, I guess. Tapping into what touches the other and these policymakers. So thank you so much for that. Now we'll be exploring our last theme, and I will be asking all of you around cross-sector collaboration. We've said it in the beginning, throughout this conference already, that road safety is about everybody, and so is the post-crash care and response. So what are the best practices that you can share around cross-sectoral collaboration in your respective countries? And and what also are the challenges? Highlight also the challenges that you face. I'd like to begin with Najibat.
Good afternoon again. I'm glad that you raised that important topic. So basically, I will be sharing Brunei's perspective on cross-sectoral collaboration, and as my role as head of Transport Safety Division and Secretariat to Brunei National Road Safety Council. In the context of Brunei Darussalam, with a population of 4,000 population and approximately 800 kilometers of roads, and a ratio of vehicle to per household is 2:1. It's actually one of the highest in Southeast Asia. Despite our size, road safety remains a critical priority. Over the past decade, road accident fatality statistics have shown both challenges and progress. This progress is the result of concerted effort in policy, enforcement, and public awareness, and a holistic approach led by the National Road Safety Council, which is chaired by my Minister of Transport and Info Communication, which also brings together key stakeholders from ministries like Ministry of Health, Home Affairs, Ministry of Development, the Prime Minister's Office, the police force, NGOs and industries representatives such as the Insurance Association, Bicycle and Motorcycle Association to address road safety holistically. This collaboration between the public and private sectors along with the NGO forms the backbone of our national road safety efforts. We also recognize the importance of involving civil society and NGOs in our road safety efforts. Organizations such as the Bicycle Association, Motorcycle Association, and other community groups plays a crucial role in raising awareness and providing support to victims and their families. The grassroots effort coupled with our national campaign helps spread vital road safety information, ensuring that the road safety is shared responsibility across the society. Cross-sector collaboration is essential for improving post-crash care and victim support system. In Brunei, we have a well-coordinated approach where multiple sectors work together to ensure a swift and effective response. Our professional emergency response team, which includes the police, firefighters, and ambulance services, operates 24/7, ensuring that help is always available when needed. Our nearly free healthcare system ensures crash victims receive immediate and long-term medical care. This includes everything from minor treatment to serious injuries, therapy, and medical health consultation, ensuring that all aspects of recovery are covered. Specialized teams, including trauma and pediatric experts, are mobilized swiftly to address the diverse needs of road crash victims. Moreover, mental health support is offered as part of the long-term recovery process, reflecting our commitment to holistic care. For those who suffer permanent injuries, as I mentioned just now, Brunei has introduced the Old Age and Disability Pension Act in 2021. For pre-hospital care provider plays a crucial role in delivering timely and effective patient care. It's essential that responders are trained not only in medical skill, but also in defensive driving to safely navigate emergency situations. When responding to incidents, they must follow a proper SOPs and guidelines to ensure efficient transport of casualty to the appropriate medical facility. Additionally, the activation of specialized teams such as the trauma and pediatric team should occur immediately, with mental health support following after the immediate care is provided. A combination of training, specialized and ongoing development ensure high quality, effective pre-hospital care. Additionally, we rely on international platforms for knowledge sharing and capacity building, such as collaboration with MIROS from Malaysia and ASEAN Dialogue partners in capacity building. This collaboration allows us to access to global best practice in road safety and emergency care, helping to enhance our local capability. Final protection for victims is another priority. The third-party insurance is mandatory for all vehicles, ensuring compensation for injuries or damage. The legal framework is also robust, with strict penalty for dangerous driving, including hefty fines and jail sentences for offense such as driving under the influence. The Road Traffic Act imposed strict penalty for dangerous driving, including up to 10,000 in prison sentence. For example, driving under the influence of alcohol or drug result in a mandatory driving ban for at least 3 years. This measure deter reckless behavior and ensure accountability. For road infrastructure, it plays a significant role in preventing accidents. Brunei roads have undergone 2 IRAD assessments in 2015 and 2024. This audit have shown significant improvement, with vehicle occupant safety rating increased from 46% in 2015 to 76% in 2024. The report have also provide actionable recommendations such as speed management and infrastructure upgrade, which we are actively implementing. As for data collection and through technology, one of the key tools driving our data-driven approach to road safety is the road accident data development and enhancement, which we call RADIT system. It's a centralized web-based accident database developed by our local university. This innovation system integrated data from multiple agencies, including the Royal Brunei Police Force, Ministry of Health, and Department of Transport to provide comprehensive overview of road accident. The RADIT system allows us to analyze accident trends, identify high-risk area, and develop target intervention. For example, it has helped us pinpoint location with high-rate accident due to speeding or poor visibility. We remain committed to leveraging technology such as the RADIT system to enhance data-driven decision-making cross-sectoral collaboration. For education and awareness are equally important. We teach the importance of safe driving from primary, secondary to tertiary level. Continuous awareness program including religious outreach, stakeholder engagement talks, and media campaign ensure that the road safety remain a priority for all. These efforts are amplified during events like World Day of Remembrance of Road Traffic Victims in November. In conclusion, the key improving post-care and victims system lies in cross-sector collaboration, whether it's integration of healthcare provider, emergency responder, or the private sector. Every link in the chain is vital. In Brunei Darussalam, ensuring financial protection for road crash victims is multifaceted effort that involve robust legal framework, comprehensive healthcare, and strong cross-sector collaboration. Although we are a small nation, our commitment to road safety is anything but small. Thank you again.
Thank you very much. You concluded very well in the way you described the collaboration that touches all the angles, all the sectors, the different elements of road safety. So thank you very much for that, for that presentation. And just, yes, please add. Yes, please add.
Thank you. I just wanted to add a sector that is never mentioned, and it has to do with justice. And I'm speaking about justice and not revenge. Many times we are told, well, justice will not bring back your loved one. We know that. But it's not fair for somebody to make a decision like stepping on the accelerator or skipping a red light or drinking and driving, and maybe they don't go to prison and maybe their license is just removed for a couple of months while we have to suffer the consequences for the rest of our lives. So here, most of us, what we want also is justice. Justice. If the person decided to skip a red light, well, that person also has to have a consequence. Yes? Thank you.
Thank you very much. I think we have to clap on that. Thank you so much. Would you like to, yeah? Especially considering, Brazil, a big country, federal state.
Yes, at the national level, we have some experience similar with hers, yes. And also thinking this capillarity of the municipalities, we have a project that was initially funded by Bloomberg in 5 capitals, and we expanded to all the capitals in the country. That's called Vida no Trânsito, and it integrates 3 arms. One of governance, as Professor Abdul told, that it is a space to look at the data. Of course, many cities doesn't have the complete data sets or the surveillance system that we want to have, but to look at the data and to take the decisions and put all the actors that are important in the same table. So justice, as she mentioned, is one of them. The policy and the municipalities use it to work together with the health sector, education, also transit agents. So in this space, they decide which hotspots they have, which areas that need one new sign, one new rule, one new velocity alert. So the intervention is doing, and then they go back to the data and see to work it or not. And in the municipalities that it was 100 implemented, the crashes decrease in around 40%, and the fatality too. So it was an initiative that started in 2014. It was increased around 2016, but in 2020 it was not funded anymore in the last government. So now we are starting to promote it again since last year, and we are now seeing some very good results in some capitals of Northeast Salvador, Natal in Rio Grande do Norte, and some cities like São Paulo too. So it's very important to put everybody together in this space of governance, as Professor mentioned before.
Much, and please a round of applause for all our panelists. Thank you so much. We will now, did somebody else want to? Sorry, I'm sorry.
Okay, so, sorry, just a very quick one. I know we've now picked on the issue of justice, and I do not know what the practice is in other countries, but in my country specifically, we have a challenge. We don't have a Good Samaritan law. In as much as I would want to help you, for example, rescue the person, take them to hospital. Once I get to hospital, the police will hold me. I need to make a statement. And that, in a way, if people don't open up, then you cannot get the justice you're looking for, because I am a witness. I should be able to respond. If I'm to give evidence, let me not be taken as the person who committed the crime. So in that way, if no one is willing to come up, you then do not get the witnesses to prosecute the cases you want to do. You want to prosecute in court to get the justice you really deserve. And that all goes back to the fact that we do not have most of our countries don't have the Good Samaritan law, and we are very hesitant to respond to disaster. You'd rather let a person die than respond to them, which is actually wrong. You should be running to help the person, maybe seek justice in the future, but you also need to be protected, because once you go without protection, you end up in jail. I just want to add that's small. Thank you.
So much. Wapan?
Well, thank you very much. I just wanted to make a brief comment on cross-sector collaboration, which is very, very important in view of the fact that we have limited resources. We always talk about road safety lacking funding. And when we collaborate, first of all, we cut down on duplication of efforts. We optimize our limited resources in terms of sharing resources and sharing funding. The other thing that we have to look into is how do we foster cross-sector collaboration. In low and middle-income countries, particularly like where I come from in Botswana, one of the things that I have noted that is really suffocating road safety and also attending to issues of victim protection, it's limited skills, limited understanding of what road safety is all about. We are still approaching road safety from a traditional perspective, where we blame everything else on the driver, on the human, forgetting to realize that this is a system that needs to be approached from a systems point of view. So I think it's very important to start the discussions around systems thinking, so that we are able to identify all players and elements within the system. That's when we can start talking about collaboration. Because if you are to be effective with collaboration, you need to know who to collaborate with, what part that person plays or that organization plays. But until you look at the whole thing as a system and understanding the contributions of different stakeholders, you will not be able to collaborate. You will still operate in silos, we will still compete, we will still think that the new players that are coming on board, they are coming to take your space. And that's what we see. And I think it's quite common in Africa, to be competing. So one of the things that we are doing as Motor Vehicle Accident Fund to promote cross-sector collaboration and also participation of the civil society in all these things is to facilitate it, is to promote it, is also to financially support it. We also organize for us, on an annual basis, stakeholder engagement sessions where we come together, we share best practices, we share information, we provide such platforms. And I'm very happy to also acknowledge some of our partners from the private sector who are really coming on board and driving advocacy around collaboration. And we have the emergency assist, they were here is a private sector. They are coming on board and supporting that. So I think the more we become intentional in terms of promoting cross-sector collaboration by organizing ourselves and not seeing ourselves as competitors, but as those that complement each other, that's when we will begin to see the fruits of cross-sector collaboration. Thank you very much.
Thank you very much, and very wise words. So this time we applaud for our panelist. And I would like to open the floor. We're a little bit behind time, but we really need to spend some time to dedicate to you to ask questions. So I think, yes.
Hi.
Go ahead.
Well, it's not it's an open question for everyone. First of all, we must work energetically and collaborate with road accident victims, as said Vivian, with the victims' associations and also with their families, because the seats we occupy today are temporary, but the loss that the victims we have suffered, that loss is permanent. We, the victims, are always pushing the road safety agenda turning our pain into a motor that never tires working, making efforts, and attend these events and participate. We must give the victims a louder voice, because otherwise we are doing what the war already does, re-victimizing. Every day, victims are ignored, and without realizing that tomorrow maybe someone among you could become a road accident victim. And please don't be offended, but I didn't want to be here because I know my sister's death could be prevented. So through all the victims associations, through FIGBI, I ask you today to see us, to listen to us, and to read this manifest, and also to share this manifest in the coffee shops, with the dental care assistants, at the supermarket. Start talking about the road accident victims and these effects that can be prevented. Start talking without these events outside. People must hear the victims outside. And please invite us to those dialogue and decisions-making tables, because there's no one more interested in preventing road accidents than those of us who have already experienced them. We know already the pain, the loss. We lived the post-trauma. And just like Vivian said, we need a restorative justice in the penal area, in the social area, and also in the psychological area, and restorative justice. We are the victims, and this is the seat that will never be vacated, and we will never be replaced. Please invite us to this delegates.
Thank you. I have a question thinking about post-crash care and rehabilitation. If we look at the SDGs, there's a lot of discussion around universal health coverage, making sure everyone can access quality health services when they need them, where they need them, without experiencing financial hardship. Now, from a policy perspective, that includes rehabilitation, but in practice, there seems to be a disconnect there. So asking the question perhaps to Prof. Bachani, to our esteemed panelists from Brazil, should we be framing post-crash care, rehabilitation, and road safety within the narrative around universal health coverage? I'm also curious to hear from Brazil. One of the challenges I see is that scaling efforts is a significant problem. What are your experiences when it comes to addressing the coverage issue on a proven effort as well?
Can I? Thank you for your question. Yes, we have since 1988 in our constitution health as a right, a human right. So it is an obligation of the Brazilian state to provide health care to every person, independently on the social class, race, gender, or any situation. So as a principle, or as a big aim, is a very challenging of operating. But there are some balancing of our budget And my main challenge is to put more money in prevention than in healthcare. Nowadays, the expense with healthcare is very, very higher than in prevention. To mobilize the other sectors to understand that prevention is a problem of the whole society is one step to achieve the coverage. Because if we economize, how can I say it? If we save money here, we can put more here. And for road traffic injuries, we have many discussions around to sensibilize the health managers. For example, we have other surgeries that stay in the line. We have a line of regulation for months because of the urgent surgeries that we have to put first. So one thing that we have to having mentioned is to convince them that prevention is more important, and with this we will be able to expand with the same budget that we have the treatments and the issues that we still have with rehabilitation and also the inclusion of these people, victims in the society. So I think it's the more challenge is to convince them to change their glasses for prevention than to increase the budget, because our budget is very high. It's very high in the country for health treatment.
Sure. No, I think that's a very important point that you raise with respect to universal health coverage, but also utilizing the Sustainable Development Goals framework. And it has, I mean, it's really refreshing to see these discussions in these conferences as well about linking road safety to other issues within that framework. Because we often talk to ourselves and we often are just, talking about the same things. And we do talk about the importance of linking to other sectors and leveraging investments in those sectors, because there is inherent and explicit benefit by doing that. Because even when we think about strengthening trauma systems, and we're talking here right now about road safety, but when we strengthen trauma systems, naturally that will impact maternal health care, that will impact other emergency services that are provided, as well as definitive care that's provided within the hospital. So really linking this to the universal health care coverage agenda, I think is extremely important for us to do. On the rehabilitation side, traditionally the way health systems have been organized, there's been a lot of importance paid to facility-based care. That narrative is shifting, and it's refreshing to see that shifting, so that rehabilitation can also come in as part of this continuum of care, not be seen as a separate tertiary service that's provided to people.
We'll take 2 questions here and 3. Those would have to be the last ones. Okay.
Sorry, no, I'm next. Sorry. No. Hello.
Emma, how are you?
Fine, thank you.
Oh, so nice
Hola,
to
Carla.
see you.
Signomi. I'm a friend of victims, as you can see. I'm also a woman who lost her son, although not to a road crash. But I'm here speaking on behalf of EAST, the Eastern Alliance for a Safe and Sustainable Transport, and FireAid, an organization I set up which assists with post-crash response, and the Eastern Partnership Road Safety Data Observatory. And I have a question, actually I'm going to address it to Dr. Abdul, which is about data. And actually, I know the pain of losing a son. I think we need to stop focusing on our pain, and we need to start focusing on good data. And we need to do that. We don't have to, we shouldn't wait for people to come to us and say, well, yeah, you're right, this is the data. We need to be advocating with something more concrete than our pain, really. And I know I've heard countries say time and again, yeah, we have a 15-minute response rate to road crashes. I work in countries where the response to a road crash can be 4 days. And you can imagine the effect on maybe a moderately injured victim becomes more and more and more severely injured as the time passes. And it's not acceptable. And that data is not collected. And we should be demanding that data. And that's what I want to say. Speaking from an observatory, speaking as somebody who's worked with governments, the data is not good enough, our arguments aren't sharp enough. We have to sharpen our active. So Abdul, I wonder if you could, from John Hopkins' perspective.
Sure. I mean, you nailed the issue right. Okay. Yeah. So we'll take the other questions and then we'll address them.
Okay. I'm also speaking as a bereaved mother, and I want to agree with Emma. I want to mention the importance of the post-crash response. As a bereaved family or parent, can you imagine having to fight for information of the circumstances surrounding your loved one's death? And that is the position we find ourselves in, having to fight for a thorough investigation into the death of our loved ones, or serious injury, as it may well be. So I just wanted to stress the importance of the police investigations, both for justice and prevention. All of our road safety efforts depend on the evidence gathered at the scene, and then the data that's shared with all of the different agencies working to prevent road crashes. And for this conference, Vivian mentioned the manifesto, the victim's voice that we have compiled. So important to all of us. And we're talking about millions and millions of families worldwide. We also have a guide for bereaved families. Again, so important to help them as they deal with the aftermath of their loved one's death. Because families are in a situation where they can barely get out of bed in the morning, and yet they're thrown into a justice system that they know nothing about, that they didn't ask to be a part of. And so we help them, and we have a guide in several languages, and we can reach to NGOs in every country, in every region, to get this information to families, to help prevent their re-traumatization, really, in dealing with not only their grief, but also having to deal with these legal processes that follow. So thank you very much for your contributions today. They were wonderful, and we really appreciate this side of it. Thank you.
Thank you very much. Do you want to begin responding, Abdul?
Sure. So I'll respond to the data thing. And yes, there are huge gaps in data and data systems in many of our countries, right? And I think there are efforts that are happening out there. You talked about the observatory work. There's the Asia Pacific Road Safety Observatory that's happening. That's the efforts in Latin America that are happening on road safety observatories. And multiple different ad hoc platforms that are working to strengthen data systems in countries. Many countries have seen the setup of surveillance systems and trauma registries, etc. However, a key theme among all these has been that once the immediate funding source that's external dries out, many of these efforts fail. We've established trauma registries in multiple different countries in Africa, and this fails. The key issue here is that we spend so much on collecting really good data, but don't focus much on how it's used. So data will only be effective if it's used appropriately. And as you said, to sharpen our arguments, to really highlight this issue and understand how it is, how it's evolving over time. But this data can also be useful in helping us improve our services over time. So trauma registry data is really useful for quality improvement programs. How well did we do in treating XYZ case of a trauma which presented a certain way? What happened? What could you have done differently? So it's about making sure that the data is available on a timely basis and is utilized appropriately so that there's value seen in keeping that effort alive. So I think the key here is that, yes, it's good to invest in the setup and establishment of these systems, but sustaining them by making sure this data is used will be extremely important.
Thank you very much. We're really past the time, but I know a lot of people had questions and had been raising their hands, so I'll take two last ones, one in the back there and the gentleman here in front.
Thank you. Maybe a question to our colleague from Uganda. A scenario that you relayed that I've come into quite often is where there is, in terms of pre-hospital and emergency response, there's often private ambulances and also government-run ambulances. So you've got a myriad of fleets. In your opinion, is this a direction that we should continue to go down in terms of supporting it, or would you advocate for a more centralized single fleet system, and just the pros and cons between that, if you wouldn't mind? Thank you.
The last question, please, short.
Hello, I'm David, and I'm from the European Federation of Crash Victims. It's a shame that we have to use family members who have died. My parents died in a crash that I was involved in. I'd like to just join up the mental health aspect and also the financial aspect, because that's when governments listen. The collation of data, as you quite rightly mentioned, is very important. But there's a primary cost, which is in my country, the UK, £1.9 million for a crash like mine. But that's the primary consideration. But there are secondary reverberations, negative reverberations that occur. And that is unhealed trauma on mental health. It's prevention in a post-crash sense to prevent the reverberation of higher incarceration rates for victims, higher divorce rates for victims as well, no long-term employment for a lot of victims because it's unhealed trauma. So I just want to know what the panel might think about having more mental health expenditure to save an awful lot of money for governments. It's not just the 1.9 million that the crash costs, but it's the cost to society when we do not take care of unhealed trauma for victims and families. There's a higher rate of heart attacks and cancer rates as well through through trauma in the families as well. And so, yeah, I just wanted to just say thank you very much to the panel as well. Your contributions were great. Thank you.
Thank you very much for these questions. Please, the panel.
Okay, thank you for the question. The pros and cons, in my opinion, I think ideally it should be the role of government to provide the services to its people. But governments also get overstretched. The budget cuts and the different priorities in, for example, funding or just budget allocation. Like I had mentioned earlier, the drop down from 2.5 million US dollars to 1.3 million US dollars that we receive from government is a huge number in terms of response. It's now fundamentally clear that government is also struggling to have these ambulances. And by the way, once we receive funding, we get ambulances. They work for a while. After a while, they completely stop working. Most of them are parked at hospitals because they can't be serviced. There's no fuel to run them. And this calls for the private players to come in place. But like we've been talking, if these private players are in place, then insurance should probably take care of these costs. And these would be the private arrangements. Once you're insured, your insurance company should be able to cover or get indemnified for the expenditure they have spent in rescuing you. But it's, I don't know, I don't think this all sides fits all. I think also may differ from country to country. The practice in Europe, like we've talked about, the response time may be about 15 minutes. In my country, response time cannot be 15 minutes. Absolutely not. I think we would be the country that has a response time of 4 days. And why? Because we do not have these structures present. We don't have a harmonized number to call. By the time you call the number, and time is going. Like I also talk about the aging fleet of ambulances we have. So all that comes into play. But ideally, in my opinion, I think if we can have a blend of both government and private, well-coordinated working together, we'll be able to have much better results and also have a much shorter response time. I hope that answers your question, and thank you very much.
Thank you, thank you. Any comments on the mental health component? Yeah.
Thank you. I think that's very true on the mental health challenge. And it's one aspect that it's like we are forgetting to cover. This is the true social impact of road crashes, to humanity. Most of the time we focus on the physical aspect, but there is such a trauma that remains unresolved, and it's a long-term impact. What we do in Botswana Motor Vehicle Accident Fund, we have recently incorporated that to ensure that the families of the survivors are catered for in terms of psychosocial, because some of them, they struggle to live up to the challenge that they have gone through. Like you rightly said, we have noted divorces. Somebody has been injured and incapacitated, and then the other partner, on the way gets tired of taking care, and then all of a sudden they divorce. And this is, I think the most important thing is to research. We need to research around these issues, because this is the kind of information that we need when it comes to driving policy. But it has to be quality information that has been researched in terms of the impact. Thank you.
Thank you very much to everyone. I really have to bring this to a close. It was an extremely enriching discussion, and you're still here in good numbers. So thank you very much for being here. Thank you, extreme thank you to our brilliant panelists. It was very, very fruitful, food for thought interactions, and I hope you all enjoyed. And look at the gender balance. I don't think any other panel was so beautifully gender balanced. So thank you so much. Thank you so much.
We from the International Road Victims Partnership would like you to come and have a photo for social awareness with the t-shirts we have representing the voice of our loved ones killed in our roads. So if you want to join us with...
Survivors are catered for in terms of psychosocial, because some of them, they struggle to live up to the challenge that they have gone through. Like you rightly said, we have noted divorces. Somebody has been injured and incapacitated, now tired, and then all of a sudden they divorce. And this is, I think the most important thing is to research. We need to research around the issues, because this is the kind of information we need when it comes to driving policy, but it is information that has in terms of impact. Thank you.
Thank you very much to everyone. I really have to bring this to a close. It was an extremely enriching discussion, and you're still here in good numbers. So thank you very much for being here. Thank you, extreme thank you to our brilliant panelists. It was very, very fruitful, food for thought interactions, and I hope you all enjoyed. And look at the gender balance. I don't think any other panel was so beautifully gender balanced. So thank you so much. Thank you so much.
We from the International Road Victims Partnership would like you to come and have a photo for social awareness with the T-shirts we have representing the voice of our loved ones killed in our road. So if you want to join us with a photo with a T-shirt to raise social awareness, please come.